Good morning, everyone. I am Jean Lorraine Briones Igargo, and today I'm going to discuss about drug education. What is drugs? Drugs are the medicines that we take or the painkillers that we take for headaches or body fatigues or the medicines that we take for our fever and cough in order for them to subdue and the other things that we need them for, be it our maintenance or antibiotics for certain medical conditions. But what is dangerous drugs? Dangerous drugs pertains to the use of illegal or legal drugs that may cause harm if we abuse or mishandle them. Specifically pertains to the use of heroin, cocaine, meth, ecstasy, and so on and so forth. There are 6 drug categories, which are central nervous system depressants, CNS stimulants, hallucinogens, dissociative anesthetics, narcotic analgesics, and inhalants. The first category is the CNS depressants. CNS depressants is a mind-altering drugs that may slow down or speed up the central nervous system and autonomic functions necessary for living. It may slow down or speed up our blood pressure, heart rate, respiration, and body temperatures. CNS depressants can impact our neurotransmitters if this type of drugs is misused. So the examples of the CNS depressants are the opioids, which is primarily designed to address pain. So example for this type of drug is morphine. Next is the tranquilizers. It is used to treat anxiety disorders or treat seizures. So the example for this type of drug is the benzodiazepines. The next example is the sedative or hypnotics. It is typically designed to assist with sleep or treat muscle spasms with muscles relaxation properties. So example for this one is Xanax. The second drug category is the CNS stimulants. It is used for treatments for certain medical conditions characterized by symptoms such as prolonged fatigue, inability to concentrate, or excessive sleepiness. CNS stimulants may also be used to help with weight loss in people who are morbidly obese. CNS stimulants have been used for the following conditions: treats attention deficit disorder, chronic lethargy, morbid obesity, and narcolepsy. CNS stimulants drugs examples are amphetamine, armodafinil, atomoxetine, and benzaphetamine, and caffeine. CNS stimulant side effects are dizziness, facial tics, headaches, and inability to sleep. Hallucinogens causes the drug user to hallucinate. Although this type of drugs is not deadly, but if you use them frequently, it can lead to psychotic breaks, psychosis, and other severe mental illnesses. Here are the examples of the hallucinogens. LSD. LSD is a commonly abused hallucinogen. It has a very real risk of significant psychiatric side effects, particularly in people that use it frequently or in large doses. One particular side effect is flashbacks. It is known to occur years after the use of drug or after the user has stopped using the LSD. The next example is the MDMA or party drugs. It acts as both a hallucinogen and a stimulant, which is the source of its popularity. However, it is also the source of its greatest danger. Many users of MDMA are severely injured or killed by extreme body temperature that increases dehydration. The third category is the Dissociative anesthetics. Dissociative drugs distorts the perception of sight and sound and create a feeling of detachment or dissociation from a person's environment and self. Its effects are mind-altering and are not technically hallucinations. So the examples for these drugs are PCP. It can create cravings and psychological dependence of the drug user. The next one is the DXM or Robo, which is popular among the adolescents because it is more readily available than illicit drugs. It is contained in cough syrups and is taken orally. Narcotic analgesics are a class of medicines that are used to provide relief from moderate to severe acute or chronic pain. These may also be called as opioids, analgesics, or narcotics. The examples for this type of drugs are methadone and morphine. Its side effects are constipation, breathing difficulty, loss of appetite, nausea, and vomiting. The fifth drug category is the inhalants. Inhalants are terms that refers to the various substances that people technically take only by inhaling these substances. These include solvents, aerosols, gases, and nitrates. So the examples of inhalants are industrial or household products include paint thinners or removers, dry cleaning fluids, gasoline, lighter fluid. For aerosols, it includes spray paints, hair or deodorant sprays. And for gases, its examples are chloroform, ether, and nitrous oxide. Although the high that inhalants produce usually lasts just a few minutes, people often try to make it last by continuing to inhale again and again for over several hours. Its side effects are mostly blurred or distorted speech, lack of coordination, euphoria or feeling high, and dizziness. Most inhalants affects the CNS and slows down the brain activity. Short-term effects are similar to alcohol. That is all, and thank you for listening.